Aloha, I'm Lyla Berg. Mahalo for tuning in to Island Focus. As you can see, we're broadcasting remotely again from my home, so you can meet some of the people who continue to be on the front lines for our safety as we navigate through this time of COVID-19. Thank you for joining us on Island Focus. Mahalo for tuning in to Island Focus and joining me in meeting Dr. Sarah Park, who is our state epidemiologist. Thank you for taking the time to be with us, Sarah.
Thanks for having me.
You know, as we're moving through this COVID-19 experience, as a pediatrician, as an expert in epidemics, as a mom, can you help us navigate a little bit more what our concerns are and what should we be paying attention to?
Yeah, so this is a pandemic where basically I think there are a lot of people that are afraid of something that you can't see. And it's really about how do we get from before to somewhere in the future where we can get back together again. And we've been through there, the first SARS, even 9/11. And I think that's what we're heading into. You know, people have heard us talk about the new normal and various things. What it really means is that life is going to change, but it doesn't mean that we can't go back to at least some, I think it's important. We're humans. We need to have connection. It's important. It's important for our children to be able to see that we have that connection, and to grow up in that. I've often talked about the fact that, masks on little children are detrimental actually to their development. They need to see our faces as social cues, and they need to see each other and to be able to know it's okay to hug people. And so that's where we're working towards, and really our families, our friends, and the different sectors of our community really having to think about how to get there.
Yeah, I appreciate you putting this in perspective, that we've had situations before. It's just so much more dramatic and the emotions are so high right now that I think what you've been saying over the years about common sense really applies now.
Mm-hmm. Yeah, and people have asked, well, what is common sense? And everyone has a different common sense. But I think it really is, if people think about all those things that I and others have always talked about, your mother has talked about, wash your hands and cover your cough and sneeze, and, staying home when you're sick, and now added to that physical distancing and masking as appropriate. But wearing masks appropriately too, because, I'm certainly not advocating, as a runner, I'm not advocating that you wear a mask while running. But, when you're doing that physical activity, be mindful that you're not deliberately coming up, brushing against people, and just mindful of that physical distancing as you're doing that physical activity. These are all these safe practices that we're talking about as really common sense, and they sound simple, but I think now everyone is pausing and thinking about this even more, and I hope really internalizing it, and all of us are thinking about this is what we all can do to protect our community, and how do we incorporate this into our community and everything we do.
And when you speak of community, it's not just the people, you're speaking also of the professions.
Right. And, there is that sense of community around our friends and family, but it is the different sectors, the industries, so, my husband is a structural engineer, and we've talked a lot about design of buildings as we move forward, and thinking about how do you design for physical distancing. If you think about it, before this all happened, everything was pointing towards, a carless society with, buildings that put everyone together in close proximity and walking about. And now I think a lot of the architects and designers are really thinking about this. I hope they are. And it's an example of how this dramatic event is affecting us, and we'll get through it. There will be new things as a result. And technology, has leaped forward in so many strides as a result of this. So there are benefits, there are advantages, and such, that I hope people see the silver lining out of all this. And I know it's hard because of the fear.
And part of the anxiety too is we just don't know.
Right.
What's next. But it's kind of exciting actually, if you think about it, if we
Right.
just don't stay anchored in our fears
Right.
or in resistance to things that were the way they were.
Right. And change is always hard. I think anyone who says they love change doesn't really understand then what change is, because I think, change is uprooting, and changing and going towards something that is different and having to embrace it. And that's a hard thing for a lot of folks. But that's what we're going to have to do to get to that new place.
Well, thank you so much. I appreciate your time and for reassuring us that we will get through this.
Thank you.
Thanks. And thank you too for tuning in to Island Focus. You've just had the opportunity to meet Dr. Sarah Park, who is the state epidemiologist. Aloha. With us today on Island Focus, I have the pleasure of talking with Captain Jeffrey Roache of the Honolulu Fire Department. Thanks for being with us, Jeff. Really appreciate you taking the time from a very busy day, I know.
It's my pleasure, Lyla.
So please help us understand. We know Honolulu Fire Department, firefighters are first responders. This is a very unusual and, as they say, unprecedented time for your department. How are you adjusting differently from your regular work?
Well, that's a very interesting question. The adjustment comes on the premise that many of the things that we are doing right now, we've always done. Mm-hmm. We've always protected ourselves at every medical call. We've always protected our respiratory, we protect our eyes, we protect our skin. With COVID, it just became that much more critical to do all of those things. And sometimes, when people just in a daily basis, they can forget or something like that, that COVID meant that we can't forget. We can't have a lax. We can't have a downtime, a down day. We have to make sure that we do it right every time. The COVID has definitely increased the critical nature of what we do, and our sense of awareness has been heightened to the extreme. And on a daily basis, it is definitely apparent that we have to continue going forward along those lines.
This period of time is very stressful and fearful for the public. Your firefighters are part of the public. They're part of us. How are you working with them to maintain the stress level?
Whenever we're on scene, we have one goal in mind: to make the situation better. When we get on scene and whatever the emergency is, we're there to make sure the public knows that we want to help them and that we're going to do our best to make sure that they get the service and the assistance that they need from the fire department, whether it's putting out their house that's burning, making sure that American Red Cross comes to their aid and they have a place to sleep that night, or whether it's just a loved one who can't breathe very well. We want to go there, reassure them, not just the patient. We're not just treating the patient, we treat the family as well. And so it's a symbiotic relationship that we have with our community. Well, we want them to be assured that when we get on scene, that they are our priority and that we're going to do our best to make sure that the situation gets better or is eliminated entirely.
With all due respect and honesty, that's the feeling we have of the Honolulu Fire Department. What have you noticed is accelerated or different in these past few months that we've been facing COVID, that you've been having to deal firsthand with the situations?
With COVID, with the advent of the new virus and the pandemic, it definitely caused us to use our PPE, our personal protective equipment. We would go through those a lot more because of the situation and the critical nature of the virus and what it does to people and how it's transmitted. So we're keeping all of those things in mind. And it also caused us as a department to come up with new guidelines on how we respond to emergencies. we came out with new internal guidelines, and we also made sure that we get ahead of the ordering of new equipment, the ordering of new sanitation devices that we use at our stations, the ordering of personal protective equipment like masks, goggles, gowns, and because the whole country is doing it. And so there is definitely going to be a lag in the delivery process. So we had to adjust what we do internally within our department and how we address the public as well. So it's been a trying time. It has stretched us as a department, but I think it's made us better too. It's made us better in our response. It's made us better in our procedures. It's made us better overall.
You know, the nature of your profession and the professionals in the field is always responding to emergencies and situations, unexpected situations. As we close our conversation, what guidance do you have for the public to maintain calm, to be able to step into the next unknown moments, feeling that we can handle it?
Continue to be ahead of the curve. Continue to make sure that you are safe, your family is safe, and that you're doing the things that are going to prevent situations that would warrant us coming on scene, like keeping your cooking attended, never leave it unattended. Fires never went away during COVID and everyone was home. So keep vigilant in those regards too. Just because we're adjusting to this new virus doesn't mean that all the other emergencies go away. So we want to make sure that we maintain our vigilance when we go out in public as well. If we go hiking on a trail, if we go into the water, even if when we're driving on the road, none of those things went away. So keep yourself safe. When you keep yourself and your family safe, that's going to make a huge difference. You have to take some responsibility in that. When that doesn't work, then we will be there to help. So definitely the community has done a lot during this time, and we appreciate them very much.
Well, thank you so much for spending a little bit of time with us, and we appreciate you. I know that you're probably not thanked enough, so on behalf of the state of Hawaii, thank you for your service, and thank you for being there to reassure our hearts. We love you very much. Thank you.
We love you guys too, and we are very appreciative, and we thank the community as well.
Thank you very much. Appreciate your time.
All right, thank you. It was my pleasure.
You've just had the opportunity to listen in on my conversation with Captain Jeff Roache of the Honolulu Fire Department. Aloha. Today on Island Focus, you will enjoy meeting Acting Chief Chris Sloman of the Hawaii Emergency Medical Services. Appreciate you being with us today, Chris. Thank you for joining us.
Thank you for having me.
Please help us understand emergency medical services, the ambulances. How do we rely on you? I know that you're always there.
You know, we're the folks that call to come help people, everything from somebody choking to having a car accident to somebody having, something unfortunate like a heart attack. We're the people that come and, do our best to preserve everyone's life and get them to, the closest place that can take care of them.
Please help us understand at the moment, with regards to COVID-19 that we're moving through, how has that impacted EMS?
COVID-19 has affected every aspect of how we've had to go about doing our jobs. Everything from the way we take calls in, from the way we answer 911 calls, and the way we have to screen those 911 calls for different criteria. What started off with very specific travel criteria has gradually had to move into other criteria, clinical symptoms, to help us identify and prepare our crews to deal with the virus and to protect themselves and to protect so that we don't become a vector, increasing the risk for other healthcare facilities and other patients down the line. An actual act of responding, it takes us longer. We've had to use a lot more personal protective equipment. We've had disruptions in our supply chain related to personal protective equipment. We haven't run out of anything, but we've had to make some tough choices where we've had to put people in less desirable equipment in order to protect them. that make their conditions just harder to work in. For example, right now we're having to transition our folks into like a Tyvek style suit. And so with the heat and the humidity and working in a plastic suit on top of wearing a plastic mask while you're doing heavy stuff, it takes a toll physically and mentally on everybody. Call volume wise, we saw our call volume actually drop through the peak of the pandemic, or at least the initial one. Since that time, since about late March, early April, when we sort of peaked as far as COVID cases went, we've gradually seen our call volume tick back up to normal. And we're about 10% below normal now, which is really interesting considering we have such a low visitor population compared to normal. But we are seeing, the recreational incidences tick back up, the hiking injuries and more car accidents and those sorts of things.
And so actually what I hear you saying is your life has continued, your professional life has continued as it is. Those of us in the community that have been consumed by fear and uncertainty, it is the nature of your profession to be in the unknown. And yet what I'm hearing you say is that we don't need to panic.
No, we don't need to panic. As we've learned more, we've adapted, and I think that's if you had to summarize what COVID-19 has been to EMS that's been our opportunity to have to improvise, adapt, and overcome, and we'll have to continue doing that for the foreseeable future, because it presents a lot of different challenges, both in the short term with how we manage operations, and then in the long term with how we deal with budgets and economies and those sorts of things going down the road.
Your staff and your personnel are just amazing for those of us who've had personal experience with EMS. How are you working with them to keep their morale high, to reduce the stress that is imposed on them?
It's difficult. The constant state of readiness that they have to maintain, the extra vigilance in as far as the use of personal protective equipment, really the at times intense fear. I don't believe we're at that level of fear that we used to be related to COVID, but there was a point in time where no one really had a good idea of what this was. And we saw a lot of courage, I think, from our personnel, because they showed up anyway, right? Not knowing what to expect. The public has been a big, huge help with their support and listening to our pleas, especially early on, to only use 911 and to call the ambulance for emergencies. And that helped us a lot to keep us from being overwhelmed and help us manage the situation to get to where we are.
And so when you say that the public has helped by calling 911 only for emergencies, has there been situations where that hasn't happened?
Yes, unfortunately. I mean, we have people, and I don't mean to make light of anybody, but we have people who call for what they think are emergencies. And I'll give you an example. Right now, we have a lot of people who are very nervous about COVID, and they might have a fever. And so, they'll call. We've had people call just because they want us to come and verify that the temperature that they're getting off of their thermometer is the same as what we get. And they don't have necessarily the intent of going to the hospital because they're not that sick, but they didn't have another resource to go out and use. And what they don't realize is that taking an ambulance out of service for something like coming and doing a temperature check means that there's the possibility we weren't available for a real emergency that was close, like an accident or somebody, having a cardiac arrest or something along those lines.
As we move into rebalancing our lives again and recuperating from this COVID experience, how is that affecting your organization?
As we move through the process of recovering from being in a very intense and rapidly changing situation to something that's, more stable, really what's changed is our understanding of it. The actual circumstances that, we've had to deal with haven't changed very much. We're going to be dealing with COVID in how we respond to things for the foreseeable future until we get to the point where, most people are immune, hopefully through, a vaccine at some point. I think by all accounts, those estimates are months, if not potentially a few years down the road before we get to that point. So for us to go through the process of recovering, we've got to put in place the temporary changes that we had to change, like the protocols for when we mandate certain PPE to be used, how and when we decontaminate certain types of equipment. Say, for example, certain cleaners on certain of our medical equipment have caused some rust and things that we've had to, the unintended consequence of using those different disinfectants when we weren't able to find, what we could because of supply chain issues. And so we've come up with, and we've had to adapt and come up with different temporary solutions. And now we're having to make all those solutions permanent so that they can be in place until we get to that point where, we have mass herd immunity to COVID.
Well, then I appreciate you framing for us that we will get through this dramatic period and we will adjust. We don't know what it is at the moment, but we will do this and we'll do it together.
Thank you.
We just had the opportunity to meet Acting Chief of the Emergency Medical Services in Hawaii, Chris Sloman. Mahalo. I'm here today on Island Focus with Luke Myers, who's the administrator with the Hawaii Emergency Management Agency. Thank you for taking the time to be with us, Luke.
Thanks for the opportunity, Lyla.
Help us understand what your agency is, where you're located, and what do we depend on you for?
Here at State Emergency Management, we're actually located in Diamond Head Crater. We're in actually one of the older facilities in the state. We're in a building that was actually built in the mid-19 teens. So around 1918, our building was built. So our building was actually here during the last great pandemic, one of the few in the state. Our major role here at State Emergency Management is to support the coordination of mitigation, preparedness, response, and recovery with federal, state, and local partners.
In layman's language, what does that mean to us in the community?
Yeah, so we're full of jargon here at State Emergency Management, but our bottom line is we help our partners get ready for all types of disasters, whether they are natural or humanly caused. And at the same time, we want them to be able to have plans in place to be ready for when those incidents occur. So like with a hurricane approaching, we get various partners together on the phone or for video teleconferencing like we've been doing for the pandemic, and we prepare for a tropical system that may be impacting us. On the other hand, we do a lot of public education and outreach with the various partners throughout the state.
Okay, so I understand a hurricane or a tsunami. It's very different than what we're experiencing now with COVID-19. What is your interplay with the community? And also, how are you helping us navigate through this?
Yeah, so we have an all hazards approach here at State Emergency Management. So we work and support the 4 counties. We have 4 peer county emergency managers: Honolulu, Hawaii, Maui, and Kauai. And we work with them specifically on a daily basis to do coordination. So if they have a resource that they need, or they need a specific type of operational support, we will work to get them that information or that specific resource. One of the big challenges that we're seeing right now is, unlike some of our other hazards, you can't see a biological threat. So really communicating to the public the need to physically distance, the need to protect our kapuna, to really be prepared, is an ongoing message with all of our partners that we have to keep up during these times.
How do you help the community navigate through the fear and through the uncertainty? You know, we've lived through tsunamis. This is different.
We rely on the health department as a lead for much of our health capacity in the hospitals in the state. And we've built up a number of resources to respond to COVID-19. As we've seen in the last week or so, we've had a bump in numbers. But we believe that we have to live with this risk and manage this risk. We understand there are going to be health impacts, but we have trust in our healthcare system to manage those as we start to see an increase in numbers as people start to get out and about. We have masks that we put on. We engage. We practice physical distancing. So that is being repeated across whether it's the private sector or public sector as these various services stand up. And we know it's challenging. The State Emergency Operations Center has been up for over 104 days, going back to February for this incident. And we've learned to adjust and manage the risk here with our team and with all the visitors that we've had at State Emergency Management. And the expectation as schools stand up, as various tourism sectors stand up, as various partners stand up in the state, they will also have to manage that risk and take some accountability in fighting COVID.
And when you're speaking of partners, those are other state agencies?
Yes, the beauty of emergency management, we have all types of partners, whether they're at the county level, the state level, the federal level, or even private. In emergency management, we work with a lot of private nonprofits, including Red Cross, the Salvation Army. So everyone's a partner from our view.
What is your sense about the sentiments of your partners right now, besides not knowing what to do specifically?
With any disaster, it takes time to stand up capabilities to respond. Unlike an earthquake or a hurricane or flood, traditionally impacts have been to infrastructure. One of the challenges with COVID is that it impacts people. It impacts the resources that actually implement the services. There is a capacity among all organizations, there's a resiliency there to get them to provide their services. But in this incident, it's a marathon. We do realize there can be some fatigue, whether it's among the public or private partners, on how they respond to an incident. And I think that's the main thing, that this is a journey that we're on, and we're going to have to learn to live with COVID. I don't think we've had a lot of causes for alarm from our partners. They just want to ensure that we're doing our proper coordination and we're communicating the risk to the public and to them, and that we're working with them on a daily basis.
Well, that's very reassuring to hear. A parting message for our audience from your agency.
We're an all hazards organization, and we understand that these are trying times for all those in the community. We ask you to continue to be resilient. This is a marathon. This is not a sprint. We're going to have a lot of ups and downs in the next couple of months, even into next spring. But we want you to know that State Emergency Management is here doing our coordination, but you all must take some accountability in preparing you and your families for whatever disasters that may come about. And we appreciate this opportunity to communicate with you all during these times.
Well, thank you very much again for your affirmation that we will get through this and to minimize our resistance against it.
Yes, ma'am, and I would ask you for further details regarding State Emergency Management. Please visit our website at ready.hawaii.gov. We have a lot of information there that individuals can consume and make themselves better prepared on. Thank you.
Thank you so much, Luke. Thank you for joining us.
Yes, ma'am. You have a nice day.
We just had the opportunity to meet Luke Myers, who's the administrator with the Hawaii Emergency Management Agency. Mahalo. Mahalo for joining us today on Island Focus as Hawaii moves through the COVID-19 pandemic that has affected all of our lives in different ways. On behalf of the crew of Island Focus, as well as the dedicated team of committed volunteers and staff at Ōlelo Community Media, aloha and malamapala. Take care of yourselves and be kind to one another. See you soon.